Hey, I'm Gary. Welcome to another segment of Interviews with Experts. Today I'm joined with Dr. Sarah, who is a Toronto-based naturopathic doctor and detox specialist. And Dr. Sarah, just recently in Eldo magazine, you wrote a very interesting article about a woman's biological clock. And it was very, very popular and well read. And I think it's a very common subject for women when they get around that 30-year-old range. Is that right? Is that the range? Okay. So tell me a little bit about that and what the urgency is, where it comes from, and how you counsel your clients.
Well, I think the urgency comes from what people hear. There's a lot of negative news around it, a lot of talk about a woman's biological clock. And the point I was trying to make with the article is that it comes down to how healthy are you? Are you taking care of yourself? And some women at 34 are even healthier than they were, let's say, at 25, because that's what it comes down to, whether or not you're taking good care of yourself.
Okay, you know, it's interesting though, just recently, within the last couple of weeks, I've got a couple of female friends who both, between the ages of 31 and 33, 34, who both have made the statement that they're going to get their eggs frozen.
Yes,
right?
Very popular.
So they're wrong. They shouldn't even be panicking.
No, they're not wrong. I mean, you can do that, but I think it's just really important to emphasize that if you are taking good care of yourself, ladies, you can get pregnant and have a healthy pregnancy and a healthy relationship in your 30s. Right? The panic that sets in is not helping your body. It's not helping finding Mr. Right. It's not going to help you get pregnant. In fact, a lot of people with the stress alone, even if they're in a relationship, they're trying to conceive, they won't conceive because of the stress and the focus that they place on getting pregnant.
So this all-consuming thought affects the health of the woman and therefore has some negative results, right?
Absolutely.
And in your article, you were also counseling women to be careful about who they perceive Mr. Right to be.
Perfect, yes.
So you tell me more about Mr. Right and your article, how there's this, again, it all comes down to this urgency of getting married or partnering in order to have a child, and you're counseling our readers in the magazine that probably you're creating a worse situation.
Absolutely. Why are women wasting their time with potential partners who they know won't marry them and won't make good fathers, or who don't have the same goals that they have? If you are dating somebody month 1, month 2, who communicates to you that they are not necessarily looking to settle down, why do women continue to date them and then complain about their biological clock? That was the point that I was trying to make.
Well, and there's a lot of discussion in that particular topic, right? But we don't have time for that today, the Mr. Right topic. But anyway, it's very important that women understand that this urgency, wherever it comes from, is not healthy.
Not healthy.
And is really not correct also.
Absolutely.
Right? Okay, well that's great advice.
Thank you.
Thank you very much. If you wouldn't mind letting our viewers know how they can get a hold of you and get some more good advice.
Good. So they can call the clinic at 416-929-1618, or they can email me directly at info@drsarah.ca.
Excellent. Thank you, Dr. Sarah.
Thank you.
Thank you for watching this segment of Interviews with Experts.